Hello, my name's John Bryant and I'm a researcher with the Humanitarian Policy Group at the ODI. ODI is an independent research institute that focuses on some of the world's pressing humanitarian and development issues. So over the next few minutes, I'll be summarising 5 key emerging findings from an ongoing piece of research we're doing here at HPG, entitled Bridging Humanitarian Digital Divides During COVID-19. So you can find links to some of our published work at the end of the presentation, as well as our contact details if you're interested in finding out more. Thanks very much. The global COVID-19 crisis has highlighted the importance of ensuring that digital technologies are designed and deployed with the most marginalised and vulnerable people in mind. That's also a pressing issue in humanitarian contexts, as responders look at continuing their existing activities in serving affected populations remotely. A common refrain from people we talk to across the sector for this research was that the current moment felt like a shift in momentum and priorities, and one that would accelerate the transition to a model of humanitarian assistance that uses more digital tools and approaches. But if the current crisis has driven a greater rate of adoption of technologies that assist in tasks like aid distribution, assessing needs, and registering aid users, it's also driven an increased awareness of the shortcomings of these tools. So is technology helping or hindering more inclusive humanitarian action during COVID-19? Here are 5 emerging findings that we've identified. 1. The digital divide, by which I'm referring here to the global inequalities in accessing and using technology and its associated benefits, is a common concern during this crisis, and with good reason. We know already about existing inequalities in, for example, smartphone access in humanitarian settings. For example, a pre-COVID study in Bidi Bidi camp in northern Uganda, which for many years was the world's largest refugee settlement, found that women are 89% less likely to access the internet through a mobile phone than male residents. Such inequalities limit the effectiveness of public health messaging and the dissemination of relief. During COVID, the risks of divides are heightened, as responders report a reduced ability to monitor and assess access to technology in person. Particular concerns have been raised for aid users with audio-visual impairments and those speaking minority languages. Both can easily be neglected as humanitarian organisations turn to existing platforms developed and controlled by for-profit entities. 2. The preference and incentives for hardware in the sector over the less glamorous elements of programming, such as staffing, ensuring digital literacy, and good community engagement, do unfortunately still appear to be present in this response. One respondent characterised this as a 2010s mindset of valuing technology or apps that ultimately overpromise their impact. So far, technologies that have been most effective have been those that are known to work at scale, such as mobile money, rather than anything new or untested, such as the many novel uses proposed for drones. In looking at the relative successes of digital approaches deployed, whether humanitarian responders had positive pre-existing relationships with affected communities prior to the pandemic was also understandably cited as very important. 3. We see multiple examples of aid users using tools to combat the so-called infodemic of false information. So for example, the World Health Organization has used WhatsApp and Facebook, and the IRC has partnered with Google and Microsoft to provide information about the pandemic to refugees and asylum seekers across Europe. Yet, as already seen in previous public health emergencies, such as the Ebola outbreaks in West Africa and more recently in the Democratic Republic of Congo, two-way communication has often lagged behind in the COVID response. The humanitarian sector justifiably has a reliance on face-to-face communication with affected people. As shown from surveys, it remains the first preference of the majority of aid users. We've heard from responders that trying to replace this kind of engagement through remote means, such as helplines, chatbots, and other online tools, is difficult, though we are now starting to see these tools be used and improved upon. Interestingly, doing so sometimes necessitates a change in organisational culture, away from just providing authoritative announcements to developing a more personalised and informal means of communicating with aid users. 4. The lack of adapting technological approaches for particular audiences at a local level was seen by many as a clear barrier for inclusion. This is despite the relative success in many contexts across, for example, sub-Saharan Africa in limiting the spread of COVID, which has been partly credited to a developed community-level health worker network and other community-based approaches. In such contexts, the kind of remote monitoring and managerial approaches we commonly see across the sector, and those made possible by digital tools, represent a bit of a missed opportunity to utilise these pre-existing local networks. In addition, in order to be a meaningful tool for coordinating responses or providing information for aid users, many mapping and assessment projects ultimately still rely on in-person verification from staff and volunteers based and working in these contexts. And lastly, the whole of society response that COVID-19 demands has highlighted that to be relevant and effective in this crisis, humanitarians will need to be aware of their role in a wider network of actors. Delivering inclusive responses through technology is now also dependent on working effectively with more specialised external actors and being aware of these wider networks of practice. It's highlighted, for example, wide variances in standards and capacities within different levels of governments, humanitarian actors, and the private sector. Working with these actors also presents risks, including around collecting big data, such as the conclude, to combine and overlay different data sets in ways that can create vulnerabilities for affected people. The trends that I've described here are emerging, and ultimately it's likely too early to tell whether COVID-19 has permanently changed the relationship between humanitarian actors, the various technologies they deploy, and aid users. Digital divides over access and use may have preceded COVID-19, but they will likely widen as a result of the crisis. Conversely, the impact of the kind of access restrictions we've seen really give an impetus to change the culture of humanitarian organisations in order to improve two-way communications and to work more effectively within global networks. Whichever path humanitarian responders follow, it's really important to remember that, as human rights advocates have long argued, technology-based tools and systems put in place during a crisis usually remain long after it's over, and that makes the need to do no harm and carefully design digital approaches to ensure inclusion critical. This has been a summary of an ongoing body of research we're working on at HPG. For more information on these topics, including how humanitarian responders across the world are adapting to COVID-19, please do get in touch or visit the links here if you're interested in finding out more. And thank you for listening.